Hi, everyone. I'm so excited for today's conversation. I hope everyone is having a good day. We're going to give it a few minutes for folks to jump in. And I'm excited for Artemisa and Kelly to talk about their programs. I'm especially excited that today we have a 40% chance of rain. And that's, we're getting ready for the monsoon season. So we hope to get it this year. How are you both doing today?
I'm doing great. We have a 0% chance of rain. I'm in Phoenix, Arizona.
Oh, man. I'm sorry to hear that.
Doing well. Thanks for the opportunity to be here today.
You're welcome. All right, so we'll give it a few more minutes. Okay, we're going to go ahead and get started. Hi, everyone, and thank you for joining us for Unite Us Live, Building Stronger Communities with CommunityCares. I'm Mayra Dominguez, Community Strategy Enablement Manager at Unite Us, where I work in Arizona helping to onboard, train, and recruit community-based organizations to CommunityCares, with a particular focus on expanding participation and access in rural communities. Prior to working this role, I spent 6 years at a nonprofit dedicated to early childhood education and prevention. So shout out to all my early childhood educators. Today, we'll be talking through the story of CommunityCares Arizona Closed Loop Referral Network powered by Unite Us. We'll hear directly from two leaders involved in building and sustaining this care coordination network into 1,500 participating organizations, serving more than 113,000 individuals statewide. First, we will have Kelly McGann, Director of Social Determinants of Health at Contexture, Arizona Health Information Exchange and Oversight Agency for CommunityCares, where she oversees the CommunityCares program. Kelly brings experience working across health and human services with community-based organizations, bringing a strong focus on the human element of SDOH interoperability and building the tools and resources with the community voice at the forefront. We're also joined by Artemisa Martinez, Executive Director for Valley of the Sun YMCA, a community-based organization participating in CommunityCares with a 97 acceptance rate and a 99.7 resolution rate, which, by the way, is a huge accomplishment. With nearly 25 years of experience in social services and public service, Artemisa leads operations at the Lincoln Downtown YMCA and oversees programs including transitioning housing, food assistance, workforce development, and veteran services. She's also passionate about building community partnerships and creating programs that support Arizona's most vulnerable populations. So thank you both for being here. How are you today?
Very good. Thank you for having us.
You're welcome. So to kick us off, Kelly, can you give us a little background on CommunityCares? What need did the network aim to address, and what helped build momentum and buy-in across organizations statewide?
Sure. Yeah, I'm going to try and cover a lot of background in just a few minutes, but I'm always happy to expand because there were a lot of starts and stops and process refinement along the way. So CommunityCares, as you mentioned, is Arizona's closed loop referral system, and it is part of Arizona's Medicaid agency, which we call Access, their whole person care initiative. So moving forward, when I say Access, just know that means Medicaid. But Access recognized that in order to improve members' health outcomes, you also needed to address their social determinants of health, or some call that their health-related social needs. They also realized that by asking providers to address the SDOH or health-related social needs of their members, Access needed to provide a tool to help those providers make connections to community-based social services. Through their investment in the program, so in CommunityCares, both our CBOs and healthcare providers are able to access CommunityCares, which is powered by the Unitas technology at no cost to those organizations. So this was able to establish a single technology solution that enables providers across different sectors to connect to address the health-related social needs for their patients and their members. It's important to understand that this is a true partnership among many organizations. And so I'm going to try and just sift through the different partners and their roles in this work. But of course, it's, a partnership of our organizations, of Medicaid, but also the community providers who are enabling this successful network. So CommunityCares is the program, as we mentioned, it's a statewide closed loop referral system across the whole state of Arizona. Access, as our Medicaid agency, is making the investment to address health-related social needs across the entire state, providing the access to this program and to the technology at no cost. Contexture, which is my organization, we are the program administrator. And so we are responsible for engagement, recruitment, implementation, and then providing post-live support and technical assistance along the way. And we partner really closely with the Unitas team to do all of those steps. So Unitas is the technology solution and the platform that enables the network across Arizona. And then we partner really closely with Solari, Crisis and Human Services, in a variety of ways. They provide and maintain access to a statewide resource directory that we ingest and enable on the platform. And then they also administer programs like the Health and Housing Opportunities Program. So just that's the background of the program, but shifting to some of the buy-in and momentum, I think it's important to acknowledge that this is really hard work for so many reasons. We're asking providers with limited capacity to adopt a new workflow, and that's really challenging. There's limited funding and availability within our community resources, and CBO capacity is a concern. And so while we've made really impressive strides in Arizona, I think it's important to recognize that we still have a lot of work to do, especially within our rural communities. What I really want to highlight, though, and what I think has been critical in our success is that throughout our efforts, we have been working within communities. So we're out across the state, we're in person, and we're working to understand, who are the right organizations in each community that we should be engaging with, what is important to them, what are the goals of that community, and then we're thinking through, how can we support each organization and community in meeting their goals? So we're not taking an out-of-box solution and rinse and repeating. We're really determining how can we customize the Unitas platform to be able to meet the individual needs and workflows of each organization. And then we provide opportunities for feedback. We listen. When we hear barriers, we try to solve for those. And then we also, if we're not able to find a solution, we'll advocate for, the changes that are needed. Maybe it's a platform enhancement so that we can be successful. And so I think that individualized support has really been critical in engaging organizations and optimizing utilization.
Thank you for sharing, Kelly. And I really do agree with what you're saying with individualizing that support, because each organization is different, each need is different. So thank you for sharing your insights. Speaking of organizations, Artemisa, from the perspective of a community-based organization like the YMCA, how has being part of a connected network changed the way your team approaches care coordination, and what difference has it made for the people you serve?
So I would say, as a community-based organization, being part of a connected network has fundamentally changed the way we approach care coordination. Because in the past, connecting these clients to resources often relied on the phone calls, emails, and even way far back in the day, the fax machines. And so while those connections were valuable, it was difficult to track whether the individuals actually received the services or to coordinate the care across multiple providers. And so it's definitely assisted and been very impactful in that way. We're able to track the referrals that are coming in and going out, right, and the actual results. Very important to have the case note components for our providers to see what communications we have had with the clients and if there's follow-ups needed on their end, or if we've uncovered any other barriers that we can refer over to other organizations. I would say that through the connected network, we're able to make those referrals more effective, communicate with all of our partner organizations, and just in real time, like you gain that visibility into the outcomes. And the time is what's most critical for us as providers. Most of the times we're addressing, again, critical needs, right? Somebody has nutrition assistance needs, somebody has a housing need, and those are things that usually can't wait. And so addressing them in real time is super important. And it allows our team to focus less on navigating those systems as providers and more on supporting the actual individuals that we're serving. And then for the people that we're serving, again, the impact is significant. We've been able to touch many people that we weren't able to in the past. So just last month in May, our organization, and this is just our anti-hunger food pantry efforts, we served 1,654 people. And the majority of those referrals come from Unitas. And the reason we've been able to have such a high acceptance and resolution rate is because answering these critical needs in a very short amount of time and addressing those, you become trusted within the community. And so many of our clients are facing multiple barriers at the same time. So the housing instability, the unemployment, food insecurity, transportation challenges, and all those kinds of different things. And this connected network helps ensure that they can access multiple services more quickly, and it reduces the likelihood that they're just going to fall through the cracks. And so at the YMCA, we've seen how these coordinated referrals have strengthened our partnerships. They, improve the service delivery, create just a seamless experience for the client, internally, externally. And ultimately, it allows us to better address the whole person, not just a single need. It helps individuals more, quickly towards stability, self-sufficiency, and just long-term success. And that makes our communities healthier. And we are just so grateful.
Thank you, Artemisa. It's so nice to hear that you have helped so many people through the platform. And I could totally relate to you with keeping track of all the resources in the community. I feel like it's impossible, especially statewide. So thank you for sharing. I would love to get some quick thoughts from the both of you for our last question. A lot of communities are trying to grow networks like CommunityCares, but struggle with sustaining engagement. What's one piece of advice you would give for building a network that's both scalable and sustainable long-term?
You can jump in here. So I think, as the program administrator, Contexture, we're looking at this from a systems perspective. And in our work, it's really critical to seek alignment and buy-in across the sectors involved in this work really early on, and then identify ways that we can support multiple state and community initiatives. And I think that has led to some of the success that we're seeing within the Arizona network. So within Arizona, again, due to the access investment, we are able to provide licenses to the Unitas platform to all of our participating organizations at no charge. Of course, there's staff costs and training costs, but the access to the platform there's no cost to access it. And so what we're seeing is that dollars can go further. And in Arizona today, there are multiple state programs across state departments leveraging CommunityCares as a statewide infrastructure to meet their aligned but maybe differing goals. And so I just wanted to highlight a couple of examples where we're seeing the state alignment really allow us to go further and faster in our work. An example I can share is the Solari program that I mentioned earlier. They're the program administrator for Access's Health and Housing Opportunities program, which we call H2O. And they leverage the Unitas technology to connect their Medicaid members to housing services. And then they're able to incorporate some expanded functionality so that those community housing providers can capture data and then generate invoices so that they're able to submit for Medicaid reimbursement. And all of this is utilizing the CommunityCares infrastructure. And then another example is with our partnership with the Arizona Department of Health Services. So we partner with them and support their diabetes prevention and education programs. Again, they're utilizing CommunityCares and Unite Us as the infrastructure and the technology to stand up a diabetes referral network. And what we're able to do here is that instead of all of these programs starting from scratch, they are able to leverage and build alignment. So we're seeing state agencies and communities really buying into this statewide alignment, utilizing the CommunityCares infrastructure as the foundation to meet, maybe their housing mission and goals for the H2O program, or we're seeing in Cochise County, they're really utilizing the infrastructure to address food insecurities within their community. And so we now have this centralized source of social care data that we can utilize to make program decisions, to better identify gaps across the state, and then to share back to state agencies the data that we're seeing so that they can make program and important policy decisions. So I think that alignment and buy-in allows us, again, to be scalable and to allow dollars to go further.
Thank you, Kelly, for explaining how Unite Us and Contexture works together, and for the insights that you have of everything that's happening and how impactful it is to have this data, not just for Arizona, but organizations as well. Artemisa, do you have anything to share?
Yes, I would say my biggest piece of advice is to focus on the relationship before technology. The technology is wonderful. It's been mastered, right? But the platform can only facilitate, connections. The people sustain the network. And so these organizations need to see the value in participating and trust that their referrals are going to be, acted upon, and feel that they're a part of this shared mission for the clients that we're serving. And so for the network to be scalable and sustainable, the partners must remain engaged. And I think that through the consistent communication, collaboration, the feedback, we need to celebrate successes and share the impact stories, and just regularly demonstrate how participation is improving these outcomes for all of the clients. And it's reducing the duplication of services, which in the past had been an issue. The impact stories are actually what are going to help some of the other people in the community who have not had success in navigating systems before. And so the impact just shows the real life connection. So at the YMCA, we just found that the engagement grows when partners understand that they're just not simply making referrals. They're part of this, coordinated system that we work together to address the complex community needs. And I think when organizations see real outcomes for the people that they serve, they become invested in the network's success.
Thank you for sharing, Artemisa. I completely agree with you that it has to be very personable and have that human element. So thank you for that insight. And thank you all for joining us today. And a huge thank you to both Kelly and Artemisa for joining us and sharing your insights. It's exciting to hear how collaboration, shared goals, and the right tech infrastructure can help communities build stronger, more connected systems of care. If you'd like to learn more about CommunityCares or join the network, you can visit our website or learn more about upcoming events in the chat below. Thanks again for spending part of your lunch break with us, and we'll see you next time at Unite Us Live.